Valerie Mercado, a dynamic media personality on the Central Coast, serves as a captivating tour guide through local eateries, breweries, wineries, and events via engaging videos and pictures on social media. Valerie is a dedicated supporter of small businesses. With over a decade of on-camera experience, she initially aired locally produced TV channels for over 10 years and has seamlessly transitioned to digital platforms. Behind the scenes, Valerie directs her productions through Noble Productions, the creative force driving Central Coast Now and Everything Central Coast, and acting as the show's marketing arm.
Welcome to another episode of Health Check with Dr. Nooristani. As the world continues to grapple with the COVID-19 pandemic, another concerning phenomena has emerged: long-haul COVID-19. Beyond the initial infection, a significant number of COVID-19 survivors are reporting a wide range of persistent and debilitating symptoms that can last for months or sometimes years. Today, we explore the mysterious and often misunderstood world of long-haul COVID-19, shedding light on its symptoms, impact, and ongoing research and the support needed for those living with our special guest, Valerie Mercado. Now, before we get into the symptoms and her journey, let's talk about what is long-haul COVID-19. Long-haul COVID-19 refers to a condition where individuals known as long haulers experience persistent and often unpredictable symptoms. Certainly, when speaking with a COVID-19 long hauler patient, it's essential to ask questions that can help assess their symptoms, well-being, and the impact of long COVID on their life. Common complaints include extreme fatigue, brain fog, shortness of breath, chest pain, heart palpitation, joint pain, and loss of taste or smell. Mental health challenges such as anxiety, depression are also frequently reported. Chronic cough for no other reason. Headaches are very common, and that could be presenting as a migraine headache, for example. Difficulty sleeping or insomnia, and diarrhea. Also, people are reporting adverse reaction to certain food that they never experienced before. So what causes this long COVID in general? Experts can't pinpoint one single cause for long COVID. Multiple factors might contribute to the cause of long COVID-19. So if you look at overall pathophysiology, it's really hard to determine. So let's look at some of these smaller changes that affect you. How is long COVID-19 diagnosed? Now, a healthcare provider diagnoses long COVID by listening to your symptoms and your health history. They may also perform tests to understand more about your symptoms and how to treat them, depending on your symptoms. Some of the basic workup includes your blood work. They take a blood sample to look at your basic panel. They might get a chest x-ray to make sure there's no co-infection with bacteria or fungus or other infection. Sometimes they definitely will do a CT scan of your chest, of the lungs, which look for an inflammatory process, infection, or any other changes that could have happened after you had the infection because of these recurring inflammation and progression of those. Also, if you have difficulty breathing or anything related to lungs, they could test for your lung function test. They tell you exactly how your lung is performing, just like your heart. It's, at what level and where it is now, and have a good baseline. Also, a simple electrocardiogram or EKG, and also echocardiogram, which is an ultrasound of your heart to make sure that your overall health is in check, and if you have any issue, that if those tests could be shed some light to it. So how do you manage and treat? There isn't one treatment for long COVID. It's all about the symptoms and how we manage depending on what kind of presentation you have. So it's very difficult to have medication that just takes care of that. So once again, we are going back to treating your symptoms. And if you have cough, if you have headache, if you have anxiety, if you have depression, etc., we prescribe medication to overcome those. but there's nothing right now to take care of your long COVID-19. We're going to take a quick break and we'll be back with our special guest, Valerie. Hi, I'm Dr. Nooristani, an internal medicine physician who's been taking care of thousands of patients in intensive care unit. A little over 2 years ago, I was introduced to a product called Balance 7. I was amazed how quickly it helped my patients. The results have been wonderful. I now recommend Balance 7 to all my patients. Order Balance 7 so you could experience great results for yourself. Go to balance7.com and improve your quality of life. So Valerie, thank you for joining us today. What kind of symptoms you had initially, and 2 years down the road, what are you suffering now?
Thank you so much for having me today. And yeah, I mean, you know, to your audience, I spent about a month in the hospital, and I spent a month in a rehab facility, and it's literally been, it'll be 2 years this week. Crazy that we're even doing this here today. But the symptoms that I suffered from then, of course, are very different today, but still going through at least some symptoms, very mild, but I definitely still have symptoms. And when I initially got COVID, you know, it was basically kind of like a cold, you know, and I honestly had been very fearful of getting COVID because I also had an autoimmune. I have rheumatoid arthritis. And so I was very fearful of getting it and thought if I got it, I was going to end up super sick and almost dying. But then I ended up, you know, sailing through about a week. And then I did everything I was supposed to do, spent my 2 weeks just not being in contact with anybody. And I thought, well, this was pretty easy. This was kind of a breeze. It worked out quite well. Well, little did I know, and I feel like all the while, and I did lose taste. So I did lose taste and I lost smell during that time. But little did I know what was brewing in my lungs. So after, I would say, almost 3 weeks even from getting COVID, I ended up going to the doctor's office because something wasn't right. I wasn't feeling well. And I believe I went a couple times and then found out that I had some level of pneumonia. I went into emergency. And that was just kind of like shortness of breath. It's so, I mean, anybody that had it and got it as bad as I did knows that feeling. And you just describe it as just, I've never been so sick in my life. Like I just was depleted. I'm a very active person and, you know, always busy doing stuff and just, you know, always working, and just this personality is just like boom, 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 boom. And I was just literally just on my recliner. I had no energy even like to go to the restroom. Like I just didn't want to move. You're just trying to get past this, and the doctor's got you on antibiotics, and you know, you're waiting for your antibiotics to kick in or whatever, you know, and nothing ever happened. And then I wasn't hungry. Like I lost my appetite completely. I immediately started losing a lot of weight. And so when I went in to emergency again, I was not well at all. And they were pumping me with oxygen and steroids and, you know, fluids and like everything. And I probably I would say within a week, I probably lost 5 pounds. I mean, I was just like, it just was taking me out fast. And I just felt awful. I mean, you know, as a doctor, I'm sure, like.
I suffer from stomach problems due to a lot of medication. I also suffer from depression. And since taking Balance 7 for the past 4.5 years, I see major improvements in both these areas. Thanks, Al, for creating Balance 7.
once again, when the first wave of COVID hit, was one of the, first in California, one of the first area that hit with COVID really hard. I was part of that care team,
Right.
and it was devastating to see patients because we just didn't know much about it, and a lot of people lost their life. As a matter of fact, I lost more patients in 2 years than 16 years of practice
My
combined.
gosh.
And it was just absolutely horrifying to see just people die at older with
Right.
initial phase, and then the younger on the second phase of the COVID. So I could understand.
Right.
I've seen firsthand what happens and how rapidly the disease evolved,
So
and people
rapid.
declined
So
much
rapid.
within days. So I had very few success stories passing like
Wow.
3 weeks, 4 weeks period of
Wow.
time, especially if they were super sick and being in intensive care unit.
Right.
So I think we deal with that. So from a physician standpoint, seeing somebody going through that ordeal for that long period of time, so it's amazing to see people are getting better from it.
Yeah.
But one of the questions comes back that now 2 years almost to this, next week will be
Yeah.
2 years anniversary for you. You're still having some of those symptoms, not obviously as severe, but a milder form. But what are those symptoms? Because we're talking about long-haul COVID. So
Right.
basically, you are termed a long hauler.
Right. Then I really was. I mean, I also had something called cryptogenic organizing pneumonia, but there's still those symptoms of having the long haul COVID, which, I just barely a month ago, I had my pulmonary function test to test my lungs thoroughly to make sure I'm at a capacity now where I'm just like, getting back to normal. And my pulmonologist was like, are you feeling pretty normal? Because, you did a pretty good job on your test. I'm always going to have scarring in my lungs. So really from any doctor's standpoint, when I go have my lungs x-rayed now, it actually looks like I have pneumonia, which I didn't even know that. And I still don't have full taste. And it took me like almost a full 2 years to gain my weight back. Like I lost 40 pounds. I got down to 100 pounds. I mean, this disease almost killed me. But thank God it didn't. And I just, today, you're just mindful of everything that you're doing. Like, I'll still have what I feel like is almost like anxiety and like palpitations. And sometimes I'll feel like if I'm out of breath or if I'm not breathing the way I should be because I'm just catching myself, it like takes me back, and I think of that time. And so there's moments like that, but the no taste and the smell has definitely been the things that have stayed with me. And just to not have taste and smell, it's, it makes it hard to eat. I have more taste. I would say my taste is back like 80% or so. Some things just will never taste the same, like chocolate, like French fries, just strange things.
All the bad
like
stuff.
all the bad stuff don't taste great to me, which I guess could be a good thing. So yeah, it's just been, and then my smell, not having smell, it's odd, it's just like, oh, you don't smell that? Like, we're in Pismo Beach and the people smoke pot all over Pismo Beach and I don't smell it at all.
Maybe it's a good thing. We're going to take a quick break. We'll come back. We'll continue this conversation.
Dear Balance 7, I'm writing to say thank you for giving me my life back. I'm 62 years old, and a few months ago, insomnia devastated my life. I had no energy, my mind was in a fog, and my memory was going. I was afraid it was dementia. My doctor prescribed a sleep aid, but it had side effects, and the sleep was never restful. I even resorted to remedies like acupuncture and a hypnotist. None of it worked. That's when I saw an ad for Balance 7. It claimed results in as little as 3 days, and I thought, what do I have to lose? So I ordered a quart, an 11-day supply. For 3 days, I took 1 ounce 3 times a day as instructed. The taste was odd, but I gotta say, not bad. By day 4, I felt amazing. I ordered a gallon, and 4 weeks in, I'm sleeping again. My energy is up, the brain fog is gone, and my memory is back. Thank you, Balance 7.
Balance 7 hits your stomach acid, producing powerful alkalinity, unlocking your body's immune system, releasing it from its acidic prison, allowing it to do what it was designed to do, keep you healthy.
Balance 7, where your body wants to be.
Welcome back. So I know that a lot of my patients suffer from emotional distress, anxiety, and depression, especially those who were hospitalized, or especially when they were in critical care or ICU unit. And so they suffer quite a bit from mental instability in so many different ways, depression and anxiety being the most common one. Has COVID or long-haul COVID has affected you in any way from a mental health standpoint?
Well, definitely. I would say more so when I was in there. You know, I think trying to stay positive, and you know, when you're going through that and you're thinking you're going to die, and you know, if the doctors know what they're doing, and at the same time, if the doctor, you know, I mean, really, like I saw 10 doctors. It took 10 doctors to diagnose me when I was in the hospital for a month. So, you know, you just kind of, along the way, you kind of lose faith too in the system, and then you have to really truly advocate for yourself. So your body's going through all these things, but then your emotions are all over the place. You're not sure if you're going to live. You know, I honestly turned to faith in a huge way when I was in the hospital, and I know I had a ton of prayers coming my way, and I just held on to that, you know, and my family. And you just have to find that inner part of you to really have the strength to continue. And like, so people out there that I just would imagine that didn't have family or didn't have faith or didn't have something to hold on to, I could see how easily you could just give up, because I almost did. Like there were moments where I'm just like, you know what, I lived a pretty good life, you know, I'm good, I can go out, and if this is my time, this is my time. But it's that constant battle within yourself and in your mind. So mentally it's tough, and going through the rehab facility was the toughest part of my life, because I was trying to gain weight, I was trying to walk again and have strength to even go home and get out of that rehab facility as I continued to decline in weight. And so, you know, how do you get up and have energy to want to get up every day when your body's just depleted and you have no strength? And so, you know, it's a constant battle. And then when you get out, then it's okay, am I ever going to live a normal life? Am I ever going to go back to normal? And I didn't think I was. You know, I honestly didn't think I was going to go back to doing what I did. I didn't want to be around people. I didn't want to ever get sick again in my life. I'm so fearful of ever getting COVID again. I mean, so many things. I mean, I clearly had PTSD, you know, but it all changed, you know, and I think a lot of it is attitude and drive, and I am a driven person, and I saw what this disease had been doing to a lot of other people, and I just kept telling myself, this isn't going to be me. There's no way that this is going to be me. I'm stronger than that. And I continued my faith. Everybody continued praying for me, and I made it out on the other side somehow.
I think one of the challenging part during the entire COVID was that inability of family to visit their loved ones within the hospital. I mean, so just restrictions were so much that you couldn't come into the hospital. Yeah. And what made it even harder for providers, the physician, was that, you know, the families or, you know, the family members are dying and the family couldn't come in. Majority of patients stood behind the window and tried to communicate. So telecommunication via FaceTime, etc. became a norm. But unfortunately, the support, emotional and mental support that all these patients need during their stay, which you know, provides extreme amount of like a positive support system, but it affects them not only mentally but physically and emotionally. Their well-being is so much better. Like, for example, if I have somebody with stroke right now, or pneumonia, or infection, sepsis, etc., the families that are there, they provide so much support, and the patient does so much better. You know, that emotionally being depressed.
If my mom wasn't able to be there, and I had it at the end of 21, so the rules were a little more lenient then, and if I wouldn't have been able to have my mom there, I don't know that I would have survived, because that was everything. Everything.
Yeah. We're going to take a quick break. When we come back, we're going to continue this conversation.
What's up, guys? My name's Justin, and look, I'm a podcaster, a natural bodybuilder, and a personal trainer, and I need energy all throughout the day. And sometimes coffee just won't do it. But what I've noticed is this Balance 7 here gives me all the energy I need all throughout the day. It not only increases energy, but it decreases inflammation and it boosts immunity. And also for the guys, you're gonna wanna hear this. It increases stamina. You need stamina. So if you wanna be better, and look, who doesn't wanna be better? Then go pick up Balance 7.
We are here with Valerie to talk about long-haul COVID-19 and its long-term effect.
There's a few things, you know, when you're released and you go home, you know, not being in the hospital, I think that also gives you a lot of anxiety, or being in rehab facility, because I was relying on all my medications and my nursing to come in and all of that. And so then, you know, the caretaker that you have at home is like everything. Like you really, if anybody had to go through that and not have a caretaker, I couldn't even imagine, because my boyfriend was my caretaker when I got home, and he took great care of me, made sure I was fed all my meals. You know, I couldn't really stand for lengths of time. I was still on oxygen. I was still on heart medication because my heart would race a lot. And I was going through all that anxiety, like of adjusting. I felt like every time I was moving to a different facility or even home, I was adjusting again to that. And so having that caretaker, I know that there was the providers that would come in and they would draw my blood and do, you know, physical therapy, you know, those services that are there. It's taking full advantage of those services, and they will come out. We had some challenges though with that. I know there were times where they weren't able to draw my blood, so then it just kind of became complicated. But you know, it's definitely, again, it's like, it's all within yourself, you know, just telling yourself you're going to exercise. And I mean, I was in a small apartment, but I like literally would walk around there and, you know, try to sit up and get down as often as I could and just exercise. And you have to really force yourself to do those things, because it's a lot of energy. Like everything was a lot of energy. Even taking a shower was a lot of energy for me. Being afraid of everything, like, and falling, which I did fall a couple times, and that wasn't good either. But I had no strength. I was just literally skin and bones. And then supplements. So I did take a supplement when I was in rehab because I needed to gain strength and appetite. So I took Balance 7, which I had taken before I went into the hospital, but everybody's so leery of you taking anything. But I did take it when I was in rehab, and that Balance 7, which I'm taking still today, gave me energy. It allowed me to gain strength, gain my appetite back. It did amazing things for me. So I'm a huge believer in supplements, and I take supplements on a daily basis, multiple supplements.
Obviously, having a positive mindset, support system around you has a huge impact, not just during COVID, during any kind of disease process for a patient. Talking about supplements, and obviously we have also transitioned knowing that certain vitamin, the zinc, the magnesium, the vitamin D, vitamin C, etc. was crucial in this, you know, the disease process of COVID and treatment. And you talked about Balance 7. We know how important, you know, that supplement is as far as, because of it is a highly concentrated alkaline that people take only 1 ounce 3 times a day, and that impact has been, I've seen it in a lot of other patients as well. Vitamin D, magnesium, etc. can definitely help that process, because your body is going through a catabolic state literally, and you're just going to be deficient in so many things. Right. But you're thriving, you're back, and you're driven, and you're pushing. Absolutely. And you're back to, you know, back to the grind. Yep.
Back to the grind.
Back to the grind. You're doing what you love. And that is, you know, success story that we could share and learn from, and kind of anytime we see a positive feedback, a positive interaction, and I think people could look at that and say, I could be that person.
You have to take away, there were so many bad things, but you really have to take away the good out of it, and there was a lot of good that came out of it. So I'm just thankful to be here today.
Well, thank you for being with us. We're gonna take a quick commercial break, and we'll be right back. Hi, I'm Dr. Nooristani, an internal medicine physician who's been taking care of thousands of patients in intensive care unit. A little over 2 years ago, I was introduced to a product called Balance 7. I was amazed how quickly it helped my patients. The results have been wonderful. I now recommend Balance 7 to all my patients. Order Balance 7 so you could experience great results for yourself. Go to balance7.com and improve your quality of life. Physical therapy. Physical therapy incorporates exercise, massage, and other treatment that can help you with pain or movement issues. Pulmonary rehabilitation. Pulmonary means lung. Lung rehab is a special kind of exercise and education program that can help you breathe better and learn how to manage breathing issue at home. The next one is counseling. Counseling gives you someone to talk to, how they can help you manage some of the psychological effect of severe long-term illness. After COVID-19, many people feel tired or run down for several weeks, but for some people, fatigue and other symptoms last for months or longer. Most people with COVID-19 recover within 12 to 18 months. As we continue to learn more about long COVID and its impact on lives worldwide, let us remain vigilant, compassionate, and united in our efforts to overcome this pandemic. Thank you for joining us on this journey of understanding and empathy. Until next episode, stay safe, stay healthy.
Tune in to Health Check with Dr. Nooristani weekly to gain insights that can transform your health journey. Let's build a healthier, happier community together. Get ready to be informed, inspired, and tune in with your health. See you on the next episode of Health Check with Dr. Nooristani. The opinions and statements made by guests on this show are their own. Noble Productions does not constitute an endorsement or validation of what is discussed.